I've been doing this work for 35 years, and there's ever since I came to MHA, probably 25 years ago. They're more of an advocacy agency than I was working with before, and we're affiliated with the state organization and the national organization that both do lobbying and raising awareness. And it is in our mission to reduce stigma and make it easier for people to access care, get past the barriers that are self-imposed in our heads to get care. And that's why this is important. I've been saying ever since I became CEO publicly, and even before that, in any public conversation I've had, or any radio show or television or whatever it might be, that it's important to get help, and it's important not to give in to that stigma that's out there. And thankfully, we're at a point where we can push it even further, and that's a great initiative in Europe. But we're finally there. We're finally to a point where the stigma is becoming less. More and more famous people, because they carry more weight than non-famous people, I guess. More and more famous people are coming out and saying, "Hey, I've had this issue or that issue," and you've had many people on your podcast personally that have opened up, and people are being more open about it, and it makes it easier for other people who are then, at a place in their life. Do I get help? Do I not get help? We're going to talk a little bit about later about what are the barriers to that, and what are keeping. Do you think your issues are worse than the other guy, and should I get all the things that go with the getting help? Worried about what people will think about you. Worried about that's where the stigma comes in. You don't want to be embarrassed. You don't want to feel like you have a problem that other people don't have, and it's just not true. We all struggle with something all the time. Somewhere time in our life, we're all struggling with something, and there's nothing wrong with getting a little help and talking to somebody, and just becoming your best you.